My name is Andy Indresano, and I am an orthopedic spine surgeon, and I am board fellowship trained, or I say board certified and fellowship trained. My patient philosophy is to give everyone a full shot at conservative treatment before considering spine surgery in particular. I think the least invasive options for the patients are usually the best in terms of reducing their pain and getting them back to normal function. Whether that be surgical or whether that be conservative treatment. So physical therapy, for example, before injections, and certainly injections before surgical options. So kind of working your way up the treatment ladder. I'm a firm believer in that, and I think patients respond really well to that, both clinically, and I think it's easier to wrap your mind around going into surgery or having something more invasive once you've adequately attempted all the conservative, less invasive treatments. I think the time that I'm willing to spend with the patient sets me apart and to a great extent. I feel as though the care I try to provide is very patient-centered, whether it be how much time they wait in the clinic or how much time we get to spend together, or how much time we have to go over a certain pathology. So I'd like to think that I spend as much time as I possibly can to make sure that patients are understanding really what's going on with them and why their pain is the way it is and where their pain is coming from. I like to think that my patients have such a great knowledge by the time that they're done working with me or going through the treatment process with me, that they have a very adequate understanding as to kind of what procedure they need and why they need that procedure versus another procedure. So I find that the more I educate my patients, that really the better they do, because the more they understand what their outcomes should be and really what their expectation should be through the treatment process.